our professional. Over to you, doctor.
Okay. So I am Sarah Kenyanjui, a clinical counseling psychologist. Yeah, currently practicing in a hospital. Yeah.
Thank you so much, doctor, for joining us
Okay.
all the way from Kenya.
Yeah.
Thank you so much.
Yeah. Welcome.
Okay. So the first question I have here is, if any person go to any doctor or the mental health specialist,
Yes.
they raise out one just question, that is, what type of depression do I have? So what kind of a depression that person usually has?
Yeah.
Or what kind of a depression are actually there, like bipolar or bipolar 1, bipolar 2, or many more like. So what are the types of the depression one any person can?
Okay, so the types of depression, we have major depressive disorder, we have acute depression, we have the other mood disorders, bipolar, and so on. So for us to know which kind of depression that a particular person have, we have to do an assessment. And basically we look at the symptoms that this patient has. And after we are done with the assessment, that is when we make a diagnosis. So we come up with a diagnosis whether this patient is having major depressive disorder, acute depression, or bipolar. Yeah.
So is it true that the different types of disorders actually respond better to different sort of treatments?
Sorry?
Different types of disorders actually respond better to different sorts of treatments. So every depression, I think every kind of depression actually has some kind of a treatment. Is that correct?
I'm sorry, I can't be able to hear you well.
Is it true that the difference of the depression actually respond better to the difference of treatments?
Yeah, sure. It is true. Yeah.
Okay. My second question is, should the depression treated with the medicine or the psychotherapy or both?
Okay, depending on how severe it is, the specialist will decide whether to start with medication or just psychotherapy. But mostly we put them together, so it will be psychotherapy and medication, depending on the severity of the depression and depending on the symptoms that this patient is going to present with.
Okay, so is it the psychotherapy often helpful for better cope with the feelings related to the depression and finding more effective ways of managing daily stresses that affect your mood?
I can't hear you so well.
Yes, is it true that the psychotherapy is often more helpful for better coping of the feelings related to the depression and finding more effective ways of managing daily stress that can affect your mood as compared to the medication?
Or as compared to the medicine?
Yeah.
Yeah, psychotherapy.
So the psychotherapy is more fruitful, is more beneficial.
Yeah, psychotherapy is more effective because mostly you will deal with behavior change, which will be long term as compared to medication, because for medication it might be short term, that is the period when this patient is on medication, but for psychotherapy it is long term because things like behavior change, and it's going to, to initiate lifestyle changes for this particular patient. So yeah, psychotherapy is more effective.
How actually the depression affects anybody's life and weight?
How actually, I think you will need to just hold up the microphone from your earphones because I'm not able to hear you.
It's okay. I was actually asking you how the depression affects anybody's appetite and weight.
How?
How depression actually affects anybody's appetite and weight. So weight increases or sometimes weight decreases because of depression the person is having. So it actually hampers the appetite as well. Is it correct?
Yeah. So yes, depression affects the appetite. So you may have a very high appetite or no appetite at all. So yeah, depression can affect the weight because of course, if you're eating a lot, then that means you will add a lot of weight. If you're not eating, then you're going to lose weight. So yes, it does affect the weight because it's affecting.
So is it true that yes, is it true that many people notice physical changes because of their depression and some lose weight because they have lost their appetite or feel sick, and others gain weight because they might stop exercising or turn to food for comfort?
Yeah, sure. Most people do notice physical changes, especially with the weight gain and the weight loss. Yeah.
Is it true that the sleep is also get affected because of the depression?
Yeah, sure. Sleep is affected. We have people who will experience insomnia, that is, they don't sleep at all, and other people are going to sleep too much. Yeah.
Depression actually causes physical pain as well in some patients.
Yeah, it can cause physical pain, especially to the extreme where we have patients who do self-harm, like they cut themselves. There's also some type of pain. It's another psychological disorder. It's called psychosomatic, where people will feel pain, physical pain, with no medical explanation. We find most patients with depression will present with physical pain. So it can be due to self-harm or due to the other disorder that is psychosomatic. Yeah.
So are any other health conditions also contributed to symptoms of the depression?
Yeah, other conditions can contribute. Let's say, for example, terminal illnesses and chronic illnesses. Yeah, so most patients who suffer from terminal illnesses and chronic illnesses will develop symptoms of depression because they will be like, why am I not getting better, or this pain is too much? And so it will start affecting their mood, which might eventually lead to depression. Yeah.
Okay, does it true that any who is suffering with the depression does actually need the medication to treat depression? Does the therapies
For children.
for anybody, for the adults, for the children, for old
Mhm.
age people? So is it true that they also need the medication as well as along with the therapies? Like
The use of medication to treat depression. Yeah, mostly
yes,
it goes hand in hand with psychotherapy, or what we call talk therapy. We normally encourage clients or patients who are on depression treatment to make sure they go see their psychologists for their therapy, and also make sure that they take their antidepressants for us to have a very for us to have a good outcome. Yeah.
so is it like the medication often with the therapy and be very highly effective to treat depression, and this can especially be true the symptoms severe or certain symptoms present such as suicidal thoughts, hopelessness, or a marked inability to feel pleasure. So is it true that medication is the only that can actually treat the depression, or just the psychotherapies are in, or both of the things go hand in hand at the same
Most of the time they go hand in hand, but again, depending on the type of patient that we have, yes, but mostly they go hand in hand.
What
Yeah.
can be the side effect of the medications for the depression? What can be the side effects?
Some side effects could be weight gain, because some medication will boost your appetite, so weight gain. Other people might sleep too much. Other people might not sleep too much. Other people might not be able to go through their daily activities, especially during the first few weeks when they start taking the medication. But once the body is used to, they're now able to go back to their daily activities comfortably. But the main side effect that people will come back complaining about mostly is weight gain.
So the pregnant women should not take any antidepressants during the pregnancy.
Sorry?
Just to make sure that the pregnant women should not take an antidepressant during the pregnancy. Just to make sure that the child is safe, secure in the womb.
Yeah, they are not supposed to take any, especially the self-administered, but if the depression is very, very severe, there are some medications which are safe for the baby. But if this person can be able to only be on psychotherapy, then it would be better for them to be on psychotherapy. And then after they deliver, and it is safe for them to take medication during breastfeeding, then at that point they can be able to take the medication. Yeah.
So, is it true that the symptoms of depression, if arise in any patient, these symptoms actually require special treatments along with the depression?
Sorry?
So these symptoms also, if any sort of symptoms of the antidepressants or anything like that in the patient who is suffering with the depression arises, so these kind of symptoms actually requires any kind of a special treatment afterwards.
After? It is not very clear.
What kind of symptoms a patient has who is suffering with the depression? When these symptoms actually arise in the patient, does these symptoms actually requires the special treatment along with the medicines of the depression?
If they present with symptoms of depression.
Yes. The
Yes.
symptoms of depression or symptoms of the medication, do these symptoms actually require the special treatment afterwards?
Some may require special treatment, but again, we will look at how severe they are. If they're not very severe and they're not affecting their daily activities, then we can, they might not require special treatment. But if they are very severe and they're affecting these patients' daily activities, then yes, they will require special treatment. Yeah.
For instance, if the depression is making it impossible for anybody to sleep, then that person actually needs to treat that insomnia kind of a situation separately, and until the full major depression is better through. So that sort of a condition the person is having, like that can't sleep at the night on the time just because of the depression. So that kind of a situation, that kind of a symptoms also needs treated separately.
Okay, kindly hold up your mic.
Yeah, sure. I was actually asking that, for instance, if anybody is having a depression and that person is also facing insomnia or the sleep or the delay sleep, he can't sleep at night on time. So that kind of a situation or the symptom needs to be treated specially in another way, along with the treatment of the depression.
Yes, so if the medication, the antidepressants are not dealing with the insomnia, then we treat the insomnia separately.
Yes.
Yes.
So it's to be treated separately or along with.
It is treated separately.
Okay.
Yeah.
What kind of lifestyle changes a person needs symptoms of depression?
What kind of?
Lifestyle changes a person needs with the symptoms of depression?
Yeah, so some changes are maybe the diet, their eating habits, and again their social life in terms of friends. Maybe they will need to move from a different city they were living in, and that is maybe the city or the house has some triggers that triggers, you know, their moods, their emotions. So, and you know, what they do and what they eat and how they interact with people. Yeah.
So getting exercise, eating well, avoiding alcohol and illicit the drugs and the regular routine might help in the depression phase. Okay.
Yes. Another lifestyle change that people will require, it's maybe if they were using psychoactive drugs, they can stop using them and, you know, just adopt a new lifestyle. So such patients will have to go through addiction counseling so that they can be able to stop using the psychoactive drugs. Yeah.
Absolutely. So are there any alternative treatment for the depression?
Yeah, there are other treatments of depression. We have electroconvulsive therapy where the brain is stimulated. So basically that will help this particular patient with uh, one of the side effects of electroconvulsive therapy is memory loss. So it is believed that if this patient goes through memory loss, then maybe they might forget about some of the things that, you know, were leading to their depression or were triggering their mood disorder. Yeah.
So the dietary supplements also helps,
That's
the addition of dietary supplement.
the addition of
Dietary supplement.
supplements.
Yeah. Or in the diet. Does it help in depression?
Yeah, it will help because maybe somebody has an issue with weight, and you know they if they lose weight, then maybe it's going to elevate their moods and they are going to feel better about themselves, and they will be able to, you know, they want to continue like that. So yeah, it will help.
Okay. So what can anybody do when there is a situation arises where person is facing emergency in the depressive phase? So what can a person actually do in that condition?
Yeah, in case of emergency, it is okay for them to call their provider. Maybe they can call their doctor, they can call their psychiatrist, they can call their psychologist, or they rush to the nearest medical facility for them to get help. They can also contact a friend or a family member who can be able to link them to a hospital or to link them to their doctor. Yeah.
Okay, is depression actually a mental illness?
Is depression?
Is actually a mental illness? Can it be
Yeah.
considered as a mental illness?
Yes, it can be classified as a mental illness, a mood disorder. Yeah, so it is a
So
mental illness.
it's like, yeah, it's like that the clinical depression can be considered as the mental illness,
Yes,
not just the depression but the clinical depression which we had actually diagnosed in the patient,
sure.
and it actually serious mental illness. So it's
Yeah,
kind
sure.
of a medical condition, not the personal weakness of any person.
Yeah,
Okay. uh, do children also get depressed?
yeah, they
They
do.
also face depression?
Yeah, sure. They also get depressed. And the only thing is that we might miss their depression phase because they are not able to express themselves like how adults will be able to express themselves. But yes, they do get depressed. So for children, what we might use is maybe art therapy, play therapy, just to help them express themselves, because some of them might be very young and they're not able to express themselves. They're not able to recognize what might be affecting them at that time. But yes, they do go through depression.
So the causes that includes in the children to be get depressed, maybe like the changes in the physical and life events they face their life, and the heredity and the inheritance what they inherit from parents, their grandparents, and environment, and the chemical disturbances also in the brain. The chemical disturbances in the brain also affects in the situation of depression, also affects children.
Yeah, sure.
So children who are actually stressed experience changes in their behavior that are persistent and destructive in their normal lifestyle, really interfering relationship with their friends, so schoolworks, and or in their relations. So is it true that it actually changes them altogether?
Yeah, it does change them, because they will not be able to interact with other people freely as they are supposed to. It might even affect how their studies and all that, and how they interact with friends and family members. Yeah.
So can a lack of sleep also causes the depression? If
Yes.
somebody is not sleeping well on time or anything like that, so is it true that the sleep deprivation also causes the depression?
We can say long-term effect, yes. If this person has not been able to sleep for a very long time, because if one is not able to sleep, then it affects their daily activities. And if your daily activities is affected, then maybe something that you wanted to do is affected, and it might make you get disappointed. So in the long term, it can cause depression. And that is why it's important for us to treat insomnia as early as we can, to prevent this patient from getting from insomnia to now depression.
Isn't that correct that the lack of depression also can be a result of other medical illness or the presence of the personal problems that can intensify depression? Or just the depression is not making the lack of sleep, or not resulting in the lack of sleep? Just lack of sleep is just the result of another medical condition the person is actually facing, or the personal problems that actually intensify the depression that patient.
Yeah,
Is that correct?
yeah, sure, it is.
So the chronic inability to sleep and the simple lack of sleep, what can be the difference between the both when it
Uh,
comes to depression?
for chronic lack of sleep is when this person is not able to sleep for a very long time. But for a short term, it could be something is happening at that particular time. They are stressed about something at that particular time, and they might not be able to sleep for about 2 to 3 days. And once they're able to deal with the issue at that moment, then they're able to go back to their normal sleeping patterns. But for long term, if somebody who's not able to sleep for maybe, let's say, for 6 months straight, they are not able to sleep. And if they sleep, they can't sleep for more than 2 hours. And that can be considered as long term. For short term, it can even go untreated, but for the long term, that is what we pay attention to, because if we don't treat it, then it might lead to other symptoms of depression. Yeah.
So are there any alternative treatments available rather than the traditional treatments we always use for the depression? Any patient can try
Are there?
any of the alternative treatments available other than the traditional treatments we actually always use on the patients, like psychotherapies or the medication or anything like that? So are there any alternative treatments also available?
Yes, they are. Yeah.
So can you name any of them?
The ones that are available.
So
Basically,
alternative therapy actually, yeah, alternative therapy actually involves a variety of the disciplines that include everything from diet to the mental conditioning and the lifestyle changes. These can be alternative treatments, I guess. Some of these have been found to be effective for treating, like exercise, sometimes considered as an alternative treatment, and has gained increasing evidence for its ability to treat the mild to the moderate forms of depression. So all exercise can also be the kind of an alternative treatment for the depression rather than the traditional treatments we actually use on the patients. So the diet also helps sometimes. Is right?
yeah, it helps. That also helps sometimes. Yeah.
Okay. So can anybody determine if an illness is causing depression or the depression is actually causing that illness? How can someone differentiate between the both?
It will depend on when the symptoms, especially the symptoms of depression, start manifesting themselves. So, did you start getting the symptoms of depression before the illness or after the illness? So, if you got the symptoms of depression before the illness, then that will mean that the depression has caused the illness. Let's say, for example, hypertension. So if you started getting symptoms of depression first, and then with time you started having high blood pressures, then we can say that depression has caused the high blood pressure. Also, we have patients who get symptoms of depression when they already have the illness. So at that moment, we will say that the illness has caused the depression. Yeah.
So the illnesses that can lead to depression are usually major, chronic, or terminal. When an illness causing depression, there is often a long-term pain or physical disability present, and there is a sudden change in the lifestyle. So these can be these can be the point where you can differentiate between the both the situations where whether the illness is actually causing the depression or the depression is actually causing the illness.
Yeah.
Okay. So, why are actually women more likely to be get depressed? Why is it? Why is that so?
They are at a very high risk because of the hormones that are produced, especially during menstruation, the hormones that are produced at that time, and also during pregnancy and breastfeeding. That is why they are at a very high risk of getting depression because of the hormones that are produced every time. Yeah.
So it can be seen in the during the menopause station, or
Yeah.
sometimes while giving birth, or something like suffering a miscarriage, or having all any kind of a stuff which includes the kind of a stress, which includes the stress.
Yeah.
So these can be the reasons behind
Sure.
the women get more likely to be get depressed.
Yeah, sure.
Okay. So why do most people with the depression attempt to commit the suicide?
Suicidal thoughts, suicidal ideations, and suicidal attempts are some of the things that we look at, because when a person is depressed, mostly they lose hope, they give up, and they do not want to continue living because they will see living as causing stress to them. So they just want to just they just want to die and move away from everything that is happening. So most patients who are depressed will attempt or will think about committing suicide, and that is the number one symptom that we look for, so that we can be able to treat depression as early as we can. Because if somebody will start being suicidal, then it means that this person is at risk of harming themselves. Yeah, so most people will contemplate suicide.
So what I'm saying is it is important to seek the professional treatment for ourselves and someone you love. If that person, if you suspect depression in that person, so it is really important to seek the professional treatment first, rather than doing yourself or just googling the how to treat it. You have to just ask the professionals to take a look at it. Is that
Yeah,
correct?
yeah, sure. It is important to seek medical help, especially from a professional, so that a
Yeah.
diagnosis can be made early and so that you can be put on medication early. Because we have some people who self-medicate and then at the end it affects them even more. And some people will start developing symptoms and then they just stay at home instead of going to the hospital, and then it will affect them even more. So it is very important if you note that you have symptoms of depression or your family member has symptoms of depression, it is very, very important for them to seek medical help as early as they can. Yeah.
So is it possible that if any person had a depression in the past can get depression ever back again?
Yeah, we say that such people are at a very high risk of getting depression again. And also we will go back to lifestyle changes. What happened at that particular time of their lives? Were they able to deal with whatever that was causing stress at that time? How strong are they, or how ready are they, or how emotionally stable are they to deal with something else that is going to arise? So yeah, most people who have gone through depression treatment are at a very high risk of getting depressed again. Yeah.
So getting the proper treatment for the correct amount of time is actually crucial in recovery and in helping to prevent or identify any future depression phase.
Yeah, sure. It is. When you get the proper treatment, then it means that you will be able to deal with situations as they come, especially if you go through psychotherapy and you're able to go through behavior change and all that. So you'll be able to deal or handle situations as they come in future. Yeah.
How long can depression last?
Basically, it depends with how well the patient is responding. You can have a patient who will respond very fast and the symptoms will go away very fast. Other patients will take time with their symptoms going away. Also, it will depend on the type of depression, because if one has acute depressive illness, then it might take a shorter time compared to somebody who had major depressive disorder. And then again, it will depend on the symptoms that this patient is going to present with. So I can say it varies from one person to the other. Yeah.
So if left untreated, various of the depressive disorders can last for months or sometimes years. A major depressive episode is characterized by a set of symptoms that typically last for a few months to many months.
Yeah, sure, sure.
Okay, so here we wrap up. Thank you so
Okay.
much for today's discussion, Doctor.
Okay.
So would you like to tell something to our viewers about GW Group or our friends or anything like that?
Sorry, too?
Would you like to tell something about GWP group, our WhatsApp group? How did you join, and what is your journey in this group or anything like that?
Okay, so I learned about the GWP group from LinkedIn, and I got interested to join. And yeah, I've learned a lot from this group, and I'm sure it will go very, very far. And I'm happy with the group because it has been able to bring professionals from all over the world together. And I think that is a very good thing. Yeah, and I'm happy to be part of it. Yeah.
Thank you so much for being a part of this interview session, Doctor.
You're welcome. Thank you.
Thank you.
Okay.
Thanks again.
Okay.